Greetings. I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's August 2020 issue. There are 5 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is a review article entitled SARS-CoV-2 Infection and COVID-19 During Pregnancy, a Multidisciplinary Review. This article is authored by Dr. Kavita Narang and colleagues from Mayo Clinic in Rochester, Minnesota. Beginning with the recognition that in prior pandemics, susceptibility to infection and attendant mortality were higher in pregnant as compared with non-pregnant women, Narang et al. Comprehensively review in the present issue of Mayo Clinic Proceedings the susceptibility to SARS-CoV-2 that may occur in the pregnant state and the manifestations and outcomes when such infection occurs in pregnancy. Homeostasis is maintained in pregnancy by a spectrum of hemodynamic, immunologic, and metabolic adaptations, and aspects of such essential responses may predispose to infection with SARS-CoV-2. For example, despite the fact that in normal pregnancy, the renin-angiotensin-aldosterone system is upregulated, normal pregnancy is characterized by systemic and regional vasodilation and hypoperfusion, mediated in part by increased production of the vasodilating peptide angiotensin 1 through 7. This peptide is produced from angiotensin 2 by ACE2, a membrane receptor normally expressed by diverse cells in health, and one that is induced in normal pregnancy. This enables the vasodilatation seen in pregnancy. Remarkably, ACE2 is one of the 2 cell surface receptors co-opted by SARS-CoV-2 to gain cellular entry. Once SARS-CoV-2 invades and replicates within cells, expression of ACE2 decreases. The consequences of such processes are several. First, increased ACE2 expression in pregnancy may predispose to infection with SARS-CoV-2. Second, the attendant reduction in ACE2 expression once SARS-CoV-2 infection occurs may impair production of angiotensin 1 through 7 and the vasodilation that this peptide sustains. Third, infection of endothelial cells with SARS-CoV-2 may cause endothelial dysfunction, the latter predisposing to vasoconstriction, inflammation, and thrombosis. Fourth, such processes are further heightened by the relative deficiency of angiotensin 1 through 7, as the latter is also anti-inflammatory and antithrombotic. The net effect of such processes is not only a predisposition to SARS-CoV-2 infection in pregnancy, but also to such complications in pregnancy as systemic hypertension and preeclampsia. Narang et al. Also discuss how the altered immune profiles depending upon the trimester of pregnancy may either predispose to infection with SARS-CoV-2 or to the cytokine storm engendered by such an infection. Physiologic changes in the respiratory tract in pregnancy, such as congestion and accumulating secretions in the upper airways, may also predispose to SARS-CoV-2 infection, while the usual dyspnea of pregnancy may cloud the appreciation of dyspnea in the pregnant patient as a warning symptom of impending COVID-19. Narang et al. Review the available data in pregnant patients infected with SARS-CoV-2 regarding maternal disease, obstetrical outcomes, and neonatal outcomes. Drawing upon guidelines issued by the relevant societies devoted to obstetrical and fetal care, and by the Centers for Disease Control and Prevention and the World Health Organization, Narang et al. Distill such information so as to provide current guidelines regarding prenatal, antepartum, intrapartum, and postpartum care. The article also discusses the implications of COVID-19 in particular pregnant patient populations and broadly outlines the treatment of COVID-19 in pregnant patients. All of these clinical sections include syntheses and summaries of information in clear tabular form. Narang et al. Are to be commended for this comprehensive, clearly written, and timely review of the impact of the current pandemic on pregnant patients. Our first highlight contains two companion papers on COVID-19. The first one is entitled Sex Differences in COVID-19 Case Fatality Rate Insights from a Multinational Registry. This original article is authored by Dr. Mohammed Al-Khuli and colleagues from Mayo Clinic in Rochester, Minnesota, and several other medical institutions. The second article is entitled Sex Hormones and Novel Coronavirus Infectious Disease, COVID-19. This special article is authored by Dr. Rasha Al-Lami and colleagues from the University of Texas Medical Branch in Galveston, Texas, and Al-Yarmouk Teaching Hospital in Baghdad, Iraq. Susceptibility to and adverse outcomes in COVID-19 may be underpinned by a number of conditions that include, among others, diabetes, cardiovascular disease, systemic hypertension, chronic lung disease, chronic kidney disease, hepatic disease, chronic debilitation, and an immunocompromised state. Additionally, it is becoming increasingly clear that sex differences are also determinants of outcomes in COVID-19. In the present issue of Mayo Clinic Proceedings, Al-Khuli et al. Examined this issue by utilizing the COVID-19 Research Network, a database available through TriNetX, the latter representing a globally based healthcare-dedicated research network. In this study, men, comprising 43% of a total population of approximately 15,000 patients, exhibited, as compared with women, increased all-cause mortality and decreased cumulative probability of survival. Because several risk factors for COVID-19, including diabetes, hypertension, coronary artery disease, were more prevalent in men, propensity score matching analyses were conducted. This demonstrated that men still evinced increased all-cause mortality and decreased cumulative probability of survival. Finally, two sensitivity analyses were performed to assess whether the worst outcomes in men reflected their older age or differential usage of angiotensin converting enzyme inhibitors or angiotensin receptor blockers. Propensity score matching in patients 50 years or older and in patients not taking ACE inhibitors or angiotensin receptor blockers demonstrated that the cumulative probability of survival was again lower in men. Al-Khuli et al. Conclude that men, as compared with women, exhibit a higher mortality in COVID-19, a susceptibility that cannot be simply explained by age or other relevant risk factors. Possible explanations for this sex-dependent outcome in COVID-19 are provided by the accompanying article by Al-Lami et al. In the same issue of Mayo Clinic Proceedings. As the authors point out, the immune system in women, as compared with men, broadly considered, is more robust and reactive, rendering the former relatively more resistant to infectious diseases. This may reflect in part the fact that a large number of immune regulatory genes congregate on the X chromosome. A salient additional consideration is that sex hormones themselves can mitigate inflammatory responses, and a substantive pathobiologic basis for COVID-19 and its complications resides in the vigorous pro-inflammatory processes that ensue after infection with SARS-CoV-2. Estrogens exert anti-inflammatory effects, including inhibition of activation of the pro-inflammatory transcription factor, NFKB, the latter possibly representing a pathway for tissue injury in COVID-19. Estrogen can also induce cytoprotective genes. Such properties of estrogens may not only contribute to the relative protection of premenopausal women against, for example, atherosclerotic coronary artery disease, but also for the better outcomes of younger women as compared with similarly aged men in COVID-19. Testosterone itself exerts anti-inflammatory effects as well as trophic effects on skeletal muscle. An age-dependent decline in testosterone in men may lead to heightened inflammation as well as impairment in respiratory muscular function when COVID-19 occurs in older men. In sum, worse outcomes in men as compared with women and COVID-19 are likely multifactorial, representing the integrative effects of a greater prevalence of comorbid conditions, sex-dependent genetic determinants of immune responses, and cellular effects and prevailing levels of sex hormones. Our second highlight also includes two papers. One is a perspective entitled Innovation Lessons from the COVID-19 Pandemic. This article is authored by Dr. Gianrico Ferrugia and Ms. Rochelle Plutowski from Mayo Clinic in Rochester, Minnesota. The second is a special article entitled The Telemedicine Musculoskeletal Examination. It is authored by Dr. Edward Laskowski and colleagues from Mayo Clinic in Rochester, Minnesota. There is a time-honored adage that necessity is the mother of invention, and in the present issue of Mayo Clinic Proceedings, Ferrugia and Plutowski discuss how the exigencies of the current COVID-19 crisis can germinate innovative strategies that may prove beneficial in the short and long term. Innovation in such circumstances, as emphasized by the authors, is underpinned by and emerges from the willingness to take risks, the dedicated application of science and technology, a cohesiveness of focus and effort among medical centers, research institutions, and the biotechnology and pharmaceutical industries, the application of information technology, public-private partnerships, and importantly, collaboration with governmental agencies. Ferrugi and Plutowski provide examples of how collaboration has enabled a number of important initiatives, including the molecular and serologic testing for the disease, clinical trials of potential therapies, vaccine development, the application of artificial intelligence, and the growth of digital healthcare. As noted by the authors, constraints against in-person healthcare caused by COVID-19 led to the rapid and extensive application of telehealth and virtual care, the latter representing a form of healthcare now reimbursed by Centers for Medicare and Medicaid Services. Such growth and gains in telehealth would likely not have occurred in the foreseeable future had there not been these challenges posed by COVID-19. Illustrating this power of telehealth and telemedicine in the present issue of Mayo Clinic Proceedings is the article by Laskowski et al., which provides for practitioners a detailed virtual musculoskeletal examination with clear text and relevant pictures and videos. In concluding their perspective, Ferrugia and Plutowski underscore the view that out of the profound challenges and loss created by the COVID-19 crisis, a unified purpose, a steadfast resolve, and a concerted effort can enable the emergence of innovative strategies and solutions, including the untapped and enduring potential of digital healthcare systems. You can access these highlights and editor's choice articles free of charge during the entire month of August. When you visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, you will find links to our social media by clicking the buttons up top of the homepage to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the homepage as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who have made a strong impact in their field of study. You will see many news stories on our website that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content and articles published online ahead of print. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.